Hello everyone. I would like today to show and demonstrate a technique that I used, and this is my passion, trigger point technique. You're gonna ask me what that means. What is trigger point therapy? Is being used with a variety of technique to deactivate the pain and also all those painful knots and contraction, and it will help you tremendously to them disappear. And you're going to ask me, how can you be able to disappear those knots? It's a very simple way to perform this technique. And I'm going to show you, because later when I explain to you, I'm going to show you and do a briefly demonstration, okay? What happens when you treat massage and incorporate a trigger point? Well, by doing this way, you are going to numb and you're going to reduce the pain. How you're going to do that? You're going to do it with some kind of pressure, consistent pressure. It will lessen the pain and you get a feedback on the pathway. Also, interrupt the pattern of pain. Another thing that it will help when you do a trigger point technique is stimulate the blood supply to remove the toxins and etc. Pressing on the trigger point also breaks the vicious cycle of pain. Stretch the tide of structure. Stimulate the blood supplies to clear away all the toxins, okay? In order to be able to do this technique the way I do it, I usually give you the client or the patient a cycle of 3 times a consistent pressure. And the only thing I ask to the client or to the patient, and you're gonna see it because I'm going to demonstrate, I just ask the patient to take a deep breath while I'm giving the sustained pressure on that specific knot. And you're gonna ask me, how do you know where is the location of the knot? It's just palpation. I have been working 11 years on this type of massage, and it's very, very simple to palpate, and you will see the spot of tenderness. You can see the nodules. You can palpate the nodules, and immediately you will feel the presence of refer pain because the client is going to tell you. Also, getting to the trigger point, the myofascial trigger point, those areas are hyper irritable. So you immediately will feel the way your client respond to you. When you find a contraction knots and you feel that lump, they look like the bands. They can be small or they can be large. Or you can feel like a small bump over that muscle. And while you are working on it, you also feel like a crunchy sound. And it's so interesting, after working that cycle of 3 times of sustained pressure, it's the same remedy. It will disappear, those knots. So I'm going to demonstrate with my model in few minutes. I hope you will understand a little bit what means trigger point and what it does for you. Thank you very much.